In a world where information seems to travel at the speed of light and traffic at a snail's pace, where the agenda of those at the helm doesn't always reflect the pressures on the streets, where the rubber hits the road, where there's queue of issues needing to be interrogated in the name of speaking truth to power.
Welcome to A Place at the Table,
where we set the agenda
table the issues that matter to you,
and invite you to take a seat at the table.
Welcome to A Place at the Table, where we make sense of issues that affect our daily lives. Make sense of this if you can. Why is it that daily 200 women in Nigeria are dying to give birth?
That's interesting, Ego. Welcome back. Is it a case of negligence or putting the hustle for money above proper investment and due process? I will be spotlighting the recent collapse of CBEX Ponzi scheme.
Zuma, you seem to be touching on issues that concern my advocacy. I will be speaking of the COS scam that has affected many Nigerians looking to japa. And you probably know someone who is affected.
You bet, Tinker. Plenty problems at home and abroad. Some might say when addressing a problem to look to the root cause. I'm saying it's time for a radical change in our system of governance. Welcome to the table, Yemi.
Thanks, Andy. You speak of problems and root causes. I speak of staying with an issue till it's resolved. It's 11 years since Chibok, and we're yet to see the outcome we desired when we first cried, bring back our girls.
Well, you can see that the issues we're bringing to the table run both deep and wide. So I know you aren't expecting us to offer any quick fixes. In that case, settle down and prepare for a robust session. Good evening, everyone. We're here to address an urgent humanitarian emergency, the devastating loss of mothers and newborns due to Nigeria's failing healthcare system. Nigeria accounts for 28.7% of maternal deaths globally, with a maternal mortality rate of 993 deaths per 100,000 live births, one of the highest worldwide. This means 200 women die daily from pregnancy-related causes, alongside rising neonatal deaths. These are not just numbers. They represent lives lost due to preventable failures. The crisis stems from chronic underfunding, with Nigeria allocating less than 6% of its budget to healthcare, which is far below the 15% recommended by the Abuja Declaration. Hospitals lack essential infrastructure. UCH Ibadan, Nigeria's first teaching hospital, experienced 100 days without electricity, rendering critical equipment useless. Access to healthcare is deeply unequal. Many rural women rely on unqualified providers, and they face fatal complications. Worse, healthcare is financially inaccessible. Earlier this year in Lagos, a woman in labor was denied care because she couldn't immediately pay the amount that she was asked. Both she and her baby died needlessly, emblematic of a system that prioritizes money over human lives. The brain drain crisis further cripples the sector, with over 6,500 Nigerian doctors having left the country in 2024, citing unsafe working conditions, leaving overstretched professionals struggling in collapsing hospitals. The human cost. Each preventable death tears families apart, depriving children of mothers and weakening communities. Beyond grief, the psychological trauma and the economic consequences ripple through generations. So what are the solutions? We need to increase healthcare funding. At least 15% of the national budget must be allocated to hospitals, equipment, and healthcare workers. We need to expand access to quality care, strengthen rural clinics, and integrate trained midwives to support maternal care. We need to ensure transparency, and we need to combat corruption. Healthcare funds must reach those in need rather than be mismanaged. We need to support healthcare workers, offer competitive salaries, safe working conditions, and incentives must be prioritized. We need to raise awareness. Grassroots campaigns should educate women on maternal health, encouraging early medical intervention. This is a national emergency. Nigeria cannot afford to continue to lose mothers and babies to preventable causes. Every delay costs lives, and it is time for decisive action. Together, we must prioritize maternal and neonatal health before more lives are lost.
As a medical doctor, I'm compelled to support your advocacy. The high numbers, I mean, they speak for themselves.
Yeah.
Only better than countries like Niger. It tells you that there is a deep problem. It's not a question of resources. We have more resources than so many other countries.
Yeah.
Why are we doing better than only countries like Niger? The case about UCH, 100 days without light, it says it all. Leadership failure at all levels. Seriously, 100 days.
Yeah.
Like, were they trying to hit a target? Were they trying to send a message to government? Whatever it is, that's failure of leadership at all levels. Things like that should never be heard of in a premier teaching hospital like UCH.
Yeah.
Definitely, as you said, way forward, we need Abuja Declaration to be respected, allocation and proper use of resources. Personally, I don't do clinical medicine anymore because the way you've described the numbers on a daily basis, that's what we see. I didn't have the heart to be seeing preventable deaths every day of my life. So I just chose to, part of the reason why I chose to leave clinical medicine.
I'd like to pick up from where Andy stopped. He said if we have more resources than other nations, right? But let's say we have more resources, but we also have more citizens to cater to.
Yeah.
And we need to remember that Nigeria is a poor country. As much as we try to tell ourselves that, oh, we have money. And also look at our budget line items. A large part, 30% of our budget for 2025 is going towards debt servicing. 27% is going towards capital expenditure. 25% is going towards recurrent expenditure. What this tells us is that what is actually going towards all the other sectors is less than 20%. Education is less than 6%. So if we say we want 15% for health, again, can we have it? Where does it want to come from?
Yeah.
And the high maternal mortality rates, it's beyond the failing Nigeria health sector. It's also cultural.
Yeah.
Because when you go to the north, the highest part of the country with the highest maternal mortality rate is in northern Nigeria. And when we look at that, it correlates with low level of education and also cultural and social norms. Cultural norms, you see women talk about, oh, I had all my 9 children at home. I didn't go to the hospital. And you are more likely to have a higher mortality rate when people don't even seek healthcare services. Do you understand what I'm saying?
Yeah, but
and also the issue of social autonomy. A lot of women can't even make the decision to go to the hospital themselves.
Which is fine.
So I feel like the solutions needs to be multi-layered. Beyond advocating for more funding in the health sector, we have to aggressively increase education, literacy rates, and also grant women autonomy over care. But there is no reason for a hospital to be asking the spouse or the partner what should be done for a woman.
So cultural norms around women who choose to have their babies at home, women who, there are certain cultures where life is not as valued, if I want to use that word. So it's a thing. My baby has died, I move on. Someone was telling me a story of a woman whose child fell in the well, but that same day she was home cooking dinner for her husband because in her mind she's going to have another baby. It wasn't a big deal. So for me, I'm not quite sure that is what, as a nation, in terms of changing, you can change those cultural norms over time. But I would say priority more should be what is controllable.
Yes.
What's controllable is UCH having light.
yes.
There's no reason, they might not have paid, there's absolutely no reason why Nigeria's premier teaching hospital will have not lights, not for one day, much less 100 days.
100.
And these things about money and budgeting and if we're rich or if we're poor, quite debatable in my view. What is clear and what has been consistent is a failure of government to prioritize health and education.
Yes.
Yeah.
So we don't have money for health, we don't have money for education, but we have money for President Tinubu to be in France or be in London or traveling for whatever reason. We have money to service debts. Even if you borrowed the money for things that are productive in nature, what are we borrowing money for? So those are things, I think for me, those are the harder conversations because underlying all of that is a lack of prioritizing the lives of Nigerians that we see in education and health in as much as we see in our response to insecurity.
I think part of the problem is the fact that we don't realize that Nigeria is a federal state. Okay, so we practice federalism. Whether you call it fiscal federalism or whatever kind of federalism, but you have a sense that there's some devolution of power, and from the central to the subnationals. And then you have what is on the exclusive list, and then what's on the concurrent list. And health is on the concurrent list, which basically means that both the federal and the state the local can legislate on it. And when you look at significant programs that impact people at the local level, it's at the primary health care.
And it's at the local government.
Which is at the local level, which is where you bring in the subnationals, the state, and all that. But you see, when we do this analysis, a lot of times, we just look at the federal government's allocation. The federal government's allocation is 5% and all that. We don't look at the subnationals. And I think that we need to start paying that attention at that level to say, Lagos State, Edo State, Ebonyi State, Enugu State.
This is what you're putting.
What are you putting there? Okay, what are you allocating for healthcare?
Yeah.
Does it meet the minimum threshold, which is 15%? Of course, I agree with you that Nigeria is a poor state. We can't afford to fund everything we need to fund. There are the minimum threshold for education, minimum for health, minimum. If we're going to meet all those minimum, we will not be able to do anything outside. So the challenge we must have is that we have to start to unwind some of the things. For instance, you mentioned that we're spending a huge chunk of money servicing debt. What have we been using the debt for? If we have been using the debt to service, to fund projects or developmental projects and not consumption, we will have been able to have a lot of what we in economics call capital accumulation in one way, that those projects will eventually, pay for themselves or yield investments that, you say that you have gotten some return on those investments. So the good thing I'm seeing right now, with what, I'm seeing with the current administration is that there's a lot of transparency around
the fiscal policies,
loans that they are taking, and those
utilization
loans are targeted at projects. So maybe that will reduce some of this loan servicing, because if we are doing the kind of numbers we're doing with loans and loan servicing, we will not have the resources to be able to give.
If I might just quickly chime in, I like your point on prioritization, so I'll not repeat that. But Zuma, all these issues around culture, delays, we know these problems, and that is where those of us in public health come in, right? There are problems that are, as you said, not related to health alone, and we know how to solve these problems. But because the resources are not there, and the point Yinka was making about not being able to do everything, if you prioritize right, you are going to do the right things. Part of China's success is being attributed to improving their public health system. Who would ever relate those two? But that's called prioritizing the right things.
When you're prioritizing the right things.
Now, there's this issue about, I like how you broke it down, that there's federal, state, and local. Where you know that it's a failure of leadership, we have what we call, for example, the Basic Healthcare Provision Fund, which they are taking from the Consolidated Revenue Fund and sharing down to the primary healthcare level. Some states will not access that because they will not bring a small counterpart. Failure of leadership. There's no excuse.
These are things we definitely must prioritize, and the loss of life is tragic enough without, let alone where it is preventable. This is why I call it a national emergency, because it's a conversation that must be had. So thank you for your
I agree
thoughts.
entirely, Ego. What's more, where you juxtapose the habitual preventable loss of life with an increasingly desperate pursuit of wealth, you have a culture of disordered values. The recent collapse of CBEX, a digital asset trading platform that promised an unbelievable 100% return in just 30 days, serves as a stark reminder of the devastating impact of Ponzi schemes and Nigeria's desire for effortless wealth. CBEX, an asset trading platform, started in 2024, exhibited all the hallmarks of a fraudulent operation. It promised an unsustainable doubling of investments monthly. It relies on a constant influx of new investors to pay off earlier ones. It focuses on aggressive recruitment tactics, and it has no identifiable owners. These were all red flags. The inevitable withdrawal, delays, followed by the complete wiping of accounts, left countless Nigerians in financial ruin. Some having invested their life savings or funds meant for essential needs. The CBEX saga is not an isolated situation. It echoes past scams like MMM, demonstrating a persistent vulnerability within the Nigerian financial landscape. These schemes thrive by preying on desperation and a desire for quick riches, particularly in environments marked by poverty, unemployment, and limited financial education. The allure of easy wealth, amplified by influencer endorsements and initial payouts, often blinds individuals to the inherent risk and illogical promises. It is important for us to break this cycle, as a new one is just around the corner. We must take responsibility as individuals and also as a community, using a multi-pronged approach. We must focus on financial literacy and proactive actions. To make better investment decisions, we must prioritize verification before investing. Always check for registration with regulatory bodies like the SEC. We must consider unrealistic returns as an immediate cause for suspicion, as legitimate investments involve risk and market fluctuations. We must make management and leadership inquiries, as genuine platforms readily provide information about their management and business model. We must avoid any investment opportunity that relies heavily on recruitment. And most importantly, we must turn whistleblowers against suspicious platforms and protect others from getting scammed. The CBEX debacle, though painful, presents an opportunity to strengthen our defenses against financial fraud. Let's collectively work towards making Nigeria a hostile environment for Ponzi schemes and safeguard the financial well-being of our citizens. Let us choose prudence over the false promises of effortless wealth.
You know, it's interesting, Zuma, because, you know, I just got to hear about this CBEX thing. I think like 2 or 3 days ago.
Yeah, same here.
You know, I just got to hear about
I think it just happened.
And I had to think about, and I thought about that why am I just hearing about it? You know, why is it that nobody in my circle brought it to my knowledge?
Try to recruit you.
They probably knew that, you know, I'm not the catchment profile or demographic, because I probably know too much to get involved in that. But it was shocking to me that, according to the reports out there, I don't know how true it is, that over $822 million were wiped off.
Interesting.
That's about 1.4 trillion naira. Now, to understand how huge that is, that's the average to which we share in FAC every month. That is the federal government and the state governments share every month. That Nigerians were able to like put that together for
over a period of time, a short period of time.
So it's a bit weird for me, and I think that all the things that you've said, you know, make sense. I just want to add that if it sounds too good to be true,
It is.
it is probably too good to be true. People should understand that in the market, you know, when we talk about investment, there's always what we look at. You always have to look at what's the annual returns.
Yeah.
Today, if you're doing money market funds, for instance, the returns are somewhere around 19 to 20% per annum.
Yeah.
Now, if you're having investments and you have returns around that number per annum, you know, not per month, you're probably in a safe space. But if somebody is promising you 20% per month, and this is 100% per month, in 30 days ahead, I mean, that's crazy.
Yeah.
But I don't know the desperation that drives people to do this, but it's worth studying.
Yeah.
But it's the same desperation that drives 419, that drives Yahoo.
Yeah,
This, as you said at the beginning, this thirst for quick wealth. And so if there's a thirst for quick wealth, there's should be an assumption that rational thinking is suspended.
Yes.
So what you're saying about if it's too good to be true, not only is that suspended, but the early days, what you hear is a testimony of it working.
Working for people. For some,
So people are able to show you that I did it and it worked for me. But that's the very nature of a Ponzi scheme is that it cannot sustain that over time. So people always thinking that before it crashes, I choose to believe that quite a number of people understand that it will crash eventually. But it's more like before it crashes, let it work for
would
me.
have cashed out.
And which is why your statement around let's make Nigeria not a
environment.
I'm not quite sure that's possible, to be very honest. in very much an environment where wealth is currency, and the pun is very much intended. Number one, and number two, where there is a desperation that's tied to also people's ability to earn and and poverty that we have. And then lastly, to Yinka's point, when he said the amount of money Nigerians were able to put together in a short amount of time. And for me, that's actually the fascinating part of it, in that if you have a country that's development-focused, development-looking, Nigerians can work alongside government as partners in developing Nigeria if there is a return, not just in monetary terms, but in a return in a quality of life that speaks for them.
The people that fall for these schemes, it needs to be studied because I just don't understand how you put in, and that's the sad part of it for me, that people put in their life savings, all their money into this, and then of course they're devastated when it falls through. But you also need to, I think, pull in some of the people that come out with these, as you said, testimonials about the fact that it has worked. Because if you really look at it, has it actually worked, or is it just saying that to lure people into, investing? There's just a lot of things that need to be done around this, but it's constantly happening. It's not the first, it's not the last, and I'm sure there are others coming up. I'd never heard of it, as you said. No, as we speak, there are literally going to be others coming up. I'd never heard of it until, it crashed, as usual. And also the fact that people were able to get 1 point something trillion raised on this fund, incredible.
Sorry, I wanted to add a joke that I saw. Someone had reached out to, I guess maybe mother of the bride or whatever, to confirm a wedding.
Yeah.
They said, oh, the bride has used all the vendors'
Oh
money
my goodness.
inside Cipex, and the groom has arrested her.
Oh my God, that is
So
a
the
joke.
wedding is
No, but it's definitely worth
I like
studying.
the way Yemi said, when they start, rational thinking is suspended. When it comes. That's why I don't even want to focus on the individuals. How about the regulatory
Bodies, yes.
right? Because shouldn't there be some legal consequences for, how did you call them,
Promoters?
celebrities that
Yes, influencers
The
that endorse
influencers?
this, yes.
well, we don't know what the law says about that, but I'm thinking, because you see, when people cannot protect themselves, that is part of government's job. During the MMM scam, NDIC went for a financial literacy something during a trade fair, and we're telling people, and people were insulting them, saying, what is government doing for us? MMM is helping us, and you're telling us it's bad. So some people will not just get it. All right?
Yeah.
Though they have been told, even when MMM crashed, it resurfaced, and they were so jubilant, and said Mavrodi has spoken to them.
And then it crashed again.
And then
Yes,
it
of
crashed
course.
again. So you see, I feel there should be some regulation. Why are we allowing these things? These Ponzi schemes used to be also popular in the West in the past, before they put a stop to it. Must we go through the same system if it has already been regulated somewhere? And
can I just, it's the nature of the scam, because they use crypto, for instance. So it's digital assets essentially. So you already have, I don't know if you know about USDT and some of this way to which you can buy some of these coins. So these are things that already exist within our financial ecosystem. People are doing Bitcoins and all that, and we're doing it. You find a way to convert your Naira to dollars, to USDT and all that, and that's what they did. So in fact, the stealing of this money wasn't as if they just took it from one wallet to another wallet,
another wallet.
and wiped everybody's wallet, essentially off. So it's the nature of it. And as much as the SEC can try, I know they can, but this is a new...
But I thought we have a
whole
regulation
new,
around this Bitcoin. CBN
They can issue
made a
warning,
position
actually.
about Bitcoin and cryptocurrency, all those. No matter the nature, we have IT experts, we have financial experts like you. There should be some...
Yeah, but I'm a financial. I didn't know about
There
it.
should be some
And that's the
regulatory
thing.
checks.
These things, they run underground in a way that people, the regulators might not even
Not
be
like they were
aware.
registered
You
or
understand?
anything.
And then, but once you identify certain bank accounts, because there will be bank accounts in Naira that are receiving this funds and all that, I think the way to go about it is to target
Yes,
those account holders.
Yes.
Yeah, so
get
please
that.
let government know that rational thinking has been suspended.
So they have
As
to
Eni said,
protect
they have to
us.
So we have
protect
to doubly
those
protect,
yes.
doubly protect citizens.
Easy come, easy go. Let us prioritize verification before investment, because where we truly value life, even the way we pursue wealth will reflect this.
You make a good point, Zuma. Desperation has caused many people to jump from frying pan to fire. Recently, a group in the UK protested to the Home Office with a banner naming and shaming those involved in what is now known as a certificate of support scam. They called on the UK government to intervene and bring to justice those involved in this scam. To understand how we got here, we need to go back to 2022, when the UK broadened a visa scheme to include care workers in what was originally designed to allow foreign medical professionals to work in the UK. To apply for the visa, candidates must first obtain a certificate of sponsorship from a UK employer licensed by the Home Office for around £525. It's the need for this COS document that made it possible for rogue relocation and recruitment agents to exploit and scam innocent victims. The tactics include illegally selling jobs in the UK care companies, devising fake payroll schemes to conceal that some jobs don't exist, shifting from care to other sectors which also face staff shortages. According to the BBC, Praise, a Nigerian, paid a doctor in the UK more than £10,000 for a job in the UK, only to realize there was no job when he arrived there. Then we read of the story of Oluwo and Ake Smith, who, according to FIJ, the Foundation for Investigative Journalism, paid £10,000 and £9,000, respectively, to a popular influencer in the Nigerian UK community for a COS which never materialized. The vast majority of these scams go unreported because the victims are afraid of reporting to the police for obvious reasons. A fact that made the scammers more brazen in their fraud. There are reports of people going homeless, families torn apart, and even victims attempting suicide because funds, mostly borrowed, are rarely returned. What's the most egregious about this scam is that it's Nigerians taking advantage of other Nigerians in the community. But we can do better. Instead of scamming people, let's provide a support system that helps them assess COS jobs and the best available information, like what we see the Indians and the Pakistanis do. Let's support them with the truth, even if that means telling them they've got no chance.
It's another
So,
scam.
Yinka, I think it's a bit similar.
It is.
When you see someone obsessed with relocation, rational
Yeah,
thinking
what can you
is
tell
suspended.
them? It is.
There is nothing you are going to
There's
tell
nothing you
that
can say.
fellow that they will change their
Yeah.
minds. And I have a problem when advanced countries monetize migration,
Access. Yeah.
right? I don't know that it's called COS, but I know so many people who tell they need so million because they need to deposit this, they need to show they can start a business. I think we need to readdress that. That's all I have to say about this. I'm putting the blame squarely on those developed countries that I think they will have to monetize migration, especially from poor countries.
So
Yes.
the thing is, once the passport
Passports, yes, I'll
you
invest.
don't live here, you are not tied to it in any way, then what is in it for us?
Yes.
Let's think of that.
Put your money where your mouth is.
Promotes this
Exactly.
kind of thing. That's what promotes
but-
this kind of thing.
No,
that's
But this
that's
is a
different.
different. This is a
Anyway,
different.
so
completely different. A lot of the people that do this, remember, you've just said it, you know, telling them they've got no chance. Again, what did we say from the previous scam? Ration, it has gone out, it's flown out the window. You can tell people they have no chance and they will borrow, as you said, to make this. So it's both parties, the people that are scamming them and the people that are willing to be scammed. Because you can actually do a bit of research.
Yourself.
Okay, yourself.
And
understand what the
Because they
system
have
is.
capacity now. You have capacity.
No,
Some
but the people that are
do have
medical
this.
professionals that are going abroad, they
There's
don't have
capacity.
capacity.
Yeah,
There's a
yeah.
level of capacity there.
Yeah.
For sure.
We're not talking about somebody that is, you know, hauling firewood or whatever.
But they're
We're
also,
talking
they're
about
also being scammed.
capacity.
Those people are there too.
True.
Okay.
But I think
Yes,
Yinka's
of
point
course,
that I
there's
want
scams
to
across
pick
the
up
board.
on is this point around how you build diaspora communities. So take the Indians, take the Pakistani, take the Chinese. There's a sense that we're coming into this country to build something, to create wealth, to be members of society. And then you see the Indians in Canada are slowly entering political office as well. You look at the UK, a lot of the mayors of the cities are Muslims. Obviously, they are not British.
Yeah.
So, or no, well, not British originally. They're now British, obviously. But when Nigerians and Africans, I dare say, go
take
into these
advantage.
countries, they almost become gatekeepers. So, first of all, they themselves are not integrated into the society.
Yeah.
Then they make themselves gatekeepers in how people access information and access entry, so to
Entry,
speak,
yeah.
but not in a good way. And I think for me, to your earlier point about things that are worth studying, that's also worth studying. Why are we like that?
Yeah.
Why are we just default wickedness to one another? Because the £10,000, we gave it to a fellow Nigerian
Yes.
who themselves migrate. I mean, you know,
You came over as well, and then you're now weaponizing this. You know,
Zuma,
we are
you seem
not
to have a
willing to
different
build
opinion.
community.
Not really. I would like
Okay.
to say we keep saying our leaders are bad, but
Yeah.
our leaders, they are a reflection of our society.
Yes.
And we are so dishonest in the little things, such that it's a no-brainer that will also be dishonest in the big things.
Yeah.
Is it even legal to buy COS? It's not. Like, why are you paying someone £10,000 for something that is 525?
25.
So so I don't think that there is any victim in this conversation.
everybody's in scam.
Everybody's
I was
yeah.
scamming
Yeah,
myself.
yeah.
yes.
Like everybody is complicit. As Andy
Yeah.
said, wahala at home and wahala abroad.
Yes.
And for me, I will
Major wahala.
I will still not absolve the UK government of responsibilities. These are people that travel to a lot of countries visa-free. Why target poor countries to put such stringent? They create the enabling environment for those camps in the first place.
You know,
How I look at
so
it.
somebody who I mean, to take a typical person who migrates to the UK, you know, through the education route. So you go and do your masters for like 18 months,
Have you
and
your
then you
wife
get
and
an extension, a visa for another 2 years. You expect to be able to get a job between that time, so that you can then you're counting the years because you want to be able to get your PR and then the citizenship. And so you're counting those years. You're already done like 2-3 years. You know that once you get to 5 years, you can get your PR. And so you need the COS, okay? And you don't have the COS. And then somebody promises you that, oh, somebody has a spot, okay? But that spot, there's so many people, you know,
vying
fight for it. So, but I am just the agent. You pay me a consultancy fee and all that, and I help you secure that spot. So that's the desperation that comes with it, and the point to which people suspend rationality and then decide to. And what makes this worse is that the money is contributed, that 10,000, 9,000, is not coming from those people alone. It's from their community.
Friends and families.
Their families.
Okay.
Putting money together to say, okay, we want to do this.
Sounds like
So
this.
it's a collective
It's
suspension.
a collective. Yeah.
Sounds like this is the abroad equivalent of buying civil service jobs in Nigeria. Because you see people say, oh, I took a loan to buy this job.
No, not really, Zuma. What Yinka explained, I can charge you my consultation fee as a doctor, 15 naira. Yinka is the same doctor
the
can
same
charge
model.
you 1 million.
Yes.
It's consultation
It's
fee.
the same model. They will tell you get the job. I will ensure you get the job. You pay me 1.5. You pay me 2 million.
They are consultants now. Must they succeed?
True.
I guess.
there is a right way to do things, and then there are the other ways.
Yinka, when it comes to our political system of governance, so far we have failed to adopt the way that is right for us. It's high time we explored another way. It appears that Africa and Nigeria in particular are not well suited for the very expensive presidential system. The role of opposition parties is central to the strength and sustainability of democratic institutions. They are meant to serve as a check on ruling governments, ensure accountability, stimulate political participation, and provide alternative policy options. In Nigeria, however, the opposition is rudimentary at best, as the presidential system ensures a winner-takes-all approach. They should be opposition members, line up to the camp to whichever party is ruling. The possibility of getting political appointments is higher if in the legislature, chairmanship or membership of the so-called juicy committees will be assured. In contrast, in the United Kingdom, for example, the leader of the opposition holds an official position and leads the shadow cabinet, strengthening oversight and offering alternative visions. Special sessions, such as the Prime Minister's questions, allow opposition to challenge the government directly. In Nigeria, even for those who do not want to cross carpet, intimidation and suppression is commonplace at all levels. The presidential candidate of the Labour Party in the last general elections, Mr. Peter Obi, claimed he was blocked from visiting Benue State by the governor. Obi claimed he was going on a humanitarian visit to IDP camps and schools, but the Benue State government said the trip was unscheduled and could not guarantee Obi's safety. It's pathetic that the security of a high-profile individual like Obi will be in jeopardy simply because he's in the opposition. It's no wonder we have such high numbers of Nigerians living in IDP camps in their own countries, particularly in Benue State. It's all about politics. If shadow cabinets were institutionalized in Nigeria and Peter Obi was a leader with some oversight on appropriations, I wonder if his safety would have been better guaranteed. Things cannot continue as usual. Radical changes are required, and the only radical changes that will not result in bloodletting will be a return to the parliamentary system of government, the institutionalization of shadow cabinets, legal and electoral reforms to empower INEC to enforce fair rules, as well as to curtail cross-carpeting to enhance party stability, as well as civic education and media freedom.
I mean, we don't have an opposition, and you're very clear. But I also disagree with you that an opposition has to be institutionalized. So the parliamentary system it is. But in the presidential system, it's really if you have clear different ideologies. Our challenge is plus APC, plus PDP, plus all of them, they're birds of the same feather.
We don't have political ideologies in Nigeria. We have personal interests.
Yeah. So it's very easy, as someone would say, to be APC in the morning, PDP in the afternoon, and Labour in the evening. That's one. Number two, even if you see opposition as a route to power, which is what APC did, there's a way that you are opposition that means you engage the affairs of the state. And so you're providing an alternative and saying, if I were in power, I would do things differently. I would engage differently. This is what I would do. And we don't see that much. What we see is Atiku will release a statement every now and again. Peter Obi will do some social service type visits to IDP camps. Something happened, he will say something, and that's it. There's really no, and like, if you want to be opposition, it needs to be back-to-back fire constant. And APC was very good at that. I mean, you will still, if you spend time online, you will find statements, comments that is coming back to haunt them now because they spoke a lot. But we don't, I mean, they're not, and APC as a party, and maybe I dare say maybe Tinubu as an individual, understands the power of an opposition. And he has been very intentional about crippling Nigeria's opposition. APC is on a mission to have a one-party state. And they have been very intentional, in my view, and very deliberate about doing that. So if the parties are not fighting themselves internally, individuals are moving to APC. So you're depleting the individuals, and then the people that are left, they're butting heads. So they don't have time to engage the affairs of the state.
My challenge with your advocacy is this comparison between the presidential system
And the
parliamentary
parliamentary.
system. You're coming away with an assumption that somehow the parliamentary system is better, probably because it's maybe less expensive, and that it has this, this institutionalization of the opposition. The challenge here is you might find yourself in a situation in Nigeria where you have a so-called parliamentary system where two parties come to form a government. And then the next day or the next week, all right, 2/3 of those parties defect to another party. And then you have to now dissolve that government and then do another election and all that. It's going to be chaos, essentially. If we don't, we have to come down to ask ourselves the question, what is the form of democracy that works for Nigeria? We have to have the courage to have that conversation. America has shown us right now that there's no moral standard for democracy. Whatever standard that America, the house on the
projected to
hill,
the world.
it's now nowhere. I mean, we know that there's no, and the reality is that nations that are supposedly undemocratic are actually doing very well, So Nigeria has to have the courage to have that conversation. What we need is democracy. It's not a question of the form of democracy. We need democracy. The question is we have to look at ourselves and then see what form of democracy works for us.
Yes.
True.
I don't know which form, but I think that we're intelligent enough to devise that ourselves.
Yeah.
I agree with Yinka. We do a lot of copy and paste ideologies or practices in Nigeria, but it's important for us to localize whatever solution we are deploying. And in all of this conversation, it's quite interesting that the 1999 Constitution states that a member of the Senate of the House of Representatives shall vacate his seat in the House, of which he's a member, if being a person whose election to the House was sponsored by a political party, he becomes a member of another political party before the expiration of the period for which that House was elected.
The loophole is that if your party has a problem,
Crisis,
so you see,
Yes.
they
No,
found
you know when the parties
found
don't
a
have
loophole to
problem.
it.
No, even when the parties don't
Is
have
there a
create a
party
problem now.
that does not have a problem?
No. In a way, no.
Anyway,
The law
let's-
is also being clear around that. So let's just be clear. The provision is if your party is split in a sense, and there were times where there were two APC camps with two APC chairmen or two Labour Party chairmen. That's a clear split. Not the fact that you have a disagreement.
How
So
many
they are
minutes
clear.
does it take to create a
do that?
split? And I can just stand up and say I'm the new NLC chairman.
But it hasn't happened that way.
And
Let's deal with the facts.
It does in
hasn't.
many parties. I don't
Most of the
mention it.
time, these things
It
are
does.
engineered.
It hasn't
The
happened that
split
way, though.
hardly happened unplanned.
Yeah.
There is
No.
always someone engineering it.
Yeah.
It hasn't happened
Or
that way.
sponsoring it.
Let's deal with the facts.
agree.
It hasn't happened that way.
I agree with you all, because I think everyone is agreed that we need to decide what sort of system works for Nigeria. We have to look at our history, our society, and just determine what is the best for us. The parliamentary system, you say that the best, it would be a return to the parliamentary system of government, but it would turn everything on its head. We have to look at our constitution. There's just so much, get the buy-in of everybody. It's a lot. And I'm not sure that you can say there'll be no bloodletting, but yes. But I think we just need to find out which one works best. I think for me, that's the end bit.
summary.
What works best for this country and determine what that is. And we have to look at our history, what has come before, and the society that we have now and what we want to achieve, what sort of society we want to achieve. And then we can then determine what kind of democracy will work for us.
As a matter of fact, Socrates described what is happening in the United States, where democracy will become to the highest bidder, and he will become so insolent that you'll be insulting the president of another country on live television. And that democracy is the second worst form of government, only after tyranny.
That you don't need opposition to be institutionalized to have an opposition.
I agree with that.
Opposition just needs to determine that they want to be opposition. But if you want to be at the table and be eating, if you don't want to stand for the people and stand contrary to the party in power, then you will compromise.
Yes.
And that's what our politicians have done, because as we started, there's no difference in ideology. They're all the same. So if being in opposition is not paying you, then you easily cross over. So
Evolution occurs because its time has come.
Yes.
Whereas the failure to evolve has been known to lead to extinction.
When we are stuck between dysfunctionality and extinction, we have no choice but to hold our existing leaders accountable. I'm asking, what is the value of a Nigerian life? "11 years ago, about 276 girls were abducted from government secondary school Chibok. Till today, the federal government has not produced a comprehensive report on the girls and their well-being. EIE Nigeria, in partnership with the Bring Back Our Girls movement, produced the first report of its kind to commemorate the 10th year of the abduction last year. If last year, the state and federal government's commitment to rescuing the remaining Chibok girls appeared to have waned, this year, it is non-existent. But Chibok girls are a marker for bad governance. It was insecurity that caused the abduction. Slow and compromised systems meant we couldn't get to them as quickly as possible. Politics meant resources earmarked for them and their families are constantly being diverted, including government stopping some of them from leaving the country. But Chibok in Borno is just one location. From Bassa in Plateau to Otukpo in Benue, these are just a few locations across the country where citizens have been abandoned by their government. Over 2,200 residents have been killed in Plateau State since 2023, with barely a blip on any radar. The Bureau of Statistics, the NBS, put the figure for kidnap ransoms between May 2023 and April 2024, about a one-year period, at 2.2 trillion naira. Then there's the language. Under Buhari, media platforms were warned from reporting news of insecurity because it supposedly emboldened the terrorists. Therefore, to find their way around it, they softened the language. They were no longer terrorists and Boko Haram specifically. They are now just bandits, cattle rustlers, and kidnappers. But really, what can citizens under attack and those watching from the sidelines do? Government will continue this dance of deafness until they realize there are real consequences for their inaction. What can we do as citizens? At this point, my thoughts are not fit for TV.
Two things for me. Insecurity that caused the abduction, and then the slow and compromised systems that made it difficult to get to them as quickly. Those two things still persist.
Yeah, indeed.
The the security situation has not improved in any way. It's just underreported.
Yes, I agree.
The systems are still slow and compromised. Yeah. If 10 years after we haven't been able to do anything different or made progress in all of that, despite the huge allocation that keeps going to security year on year, when do we get it right?
As I say, jam question.
Real jam question. Are we allocating money and there's no plan? Or, you know, have we not determined that, okay, I'm allocating all this money for security and this is what I'm going to do to achieve this security? Because I don't understand how, as you said, year in, year out, we're having all these issues constantly. You mentioned 2 weeks ago all that happened. Why does it continue? I think there are many underlying reasons that we're not hearing about. We're not being told the exact situation.
Yeah.
Because it just can't be, you know, this just insecurity, lack of, you know, what is the plan? What have you determined? We have security forces in this country. What are they doing? What have you determined that should be done? We've had this happen government to government each time this occurs. So what are we missing? There's something missing.
I mean, one of the things, for example, I've heard said, and just to show you also the cynicism in the whole process, is in some areas where, to your point about opposition, if a government feels that they're not friendly and there's a lot of insecurity in that area, you kind of leave them. So, because when it comes time to elections, the place is in such a mess that their votes can't affect. They won't vote against you. So
we would even say, okay, accept that if there was even security anywhere else.
In other parts of the country.
So I will say two things before I hit the matter on the table. I like how you mentioned the intimidation of media, you know, in the last administration. That's the intimidation we're talking about. Now, the other thing is, when I said about changing, when the system is bad, when the foundation is bad, what can the righteous do, right? There is already too much bloodletting going on. I don't think there can be anything worse. In my local government, in my state, people cannot go and even bury their loved ones and sleep. They go in the morning with security, drop the corpse, and run back. It's not in the news. I did this I think it was one of my very first advocacies. Nobody is even talking about it. Look at now. Something struck me from your advocacy. You say about 11 years later, we don't even know the exact number. It shows how cheap life is. What else are we afraid that will happen that's not happening? Because we're in Lagos and Abuja, you cannot even travel 100 kilometers by road anymore. You have to keep your ransom. So what are we talking? Everything is already upside down. We might as well try something new to turn the things upside down again. Then let's see if it will rearrange. Listen to what the figure you read. Kidnappers in trillions.
Yes.
Tell me, does that sound like you have a country that is functional? Well, gradually descending into a dysfunctional state. If we are not already dysfunctional.
And that's a very interesting point. According to the parameters of a dysfunctional state, Nigeria is. Yes. But it's hard to have the conversation because life continues. I say it all the time. In any day in Lagos, you have at least 10 parties, if not 50, from Ekpe to Badagry. So in a culture or in an environment where life is seemingly still normal, it's very hard for these hard conversations to sit.
Yemi's advocacy hit home on many points. The fact that 11 years, we're still talking about, the Chibok girls and all that. I think we still have close to 100 not back.
We're about 80.
Okay, so, and out of 200 and 30-something girls.
Nobody knows the figure.
That's also, I remember that yearly we used to have, activities around, bring back our girls. Yeah. It seems we've gone silent, now. Even I didn't even hear anything this year. We must do better. And it takes me back to what we discussed here, I think a few weeks ago as well, when we were talking about, I think it was your advocacy, when you talked about the guy that died on the bike.
Yeah.
TJ, yes. And it was a very sad story. And I remember Aisha was saying that we have a problem in this country that, when there's crisis and there's a bad thing that happens, we don't
take learnings.
We don't learn from it, and something good doesn't come out of it.
Yes.
That bad things happen everywhere in the world, but you see people learn from it and they improve their systems. Yes. And I remember talking about the Amber Alert in the US, how it came out of a young girl missing. Yes. And then in the US today, anybody missing at all, you get this Amber Alert that comes on your phone. It's not even a text, it's a prompt on your phone and billboards everywhere. Yeah. The Chibok girls was that moment for us in this country to try to do something better. Not just for girls in the north, but every child in school. Yeah. Safe school initiatives, improving education. To use that as a point of advocacy, you understand, for our legislators to pass laws, on the Chibok bill or something like that.
Accountability speaks of an acknowledgement that we owe one another a duty of care. One way to discharge this duty is by engaging on the issues that affect us all. Join us, same time next week, and lend your voice to the critical conversations at the table. Till then, it's goodbye from all of us.
Goodbye.
Bye.